Hey guys, it's Dr. Josh here. Welcome to my Hormone Masterclass. This is called Solving the Cycle. These are the keys to dealing with hormone issues like PCOS, infertility, PMS, and other cycle issues. So this talk is mainly focused at women that have a menstrual cycle or that should have a menstrual cycle and maybe don't right now. We're going to cover all the basics of hormones. We're going to talk about what you can do starting today to take action to get your hormones more under control and more balanced. Then we'll talk about some of the ways that I work with patients all over the country using some really cool functional lab tests to see how your body's working, how it's not working, and some of the lab-based supplement protocols we use to get your body working as best as it possibly can. So there's also some good information for women that might be going through menopause or right before or after menopause, but this is mainly for women that have a cycle or that should have a cycle. So some of the common conditions that I see every day in my clinic and I talk to women about every single day in my practice are going to be PCOS. Seeing that more and more, it's really becoming a big issue nationwide. It's contributing to fertility problems, which is also something that we help with. And another common problem we see is mood irregularities, so anxiety, depression, fatigue, PMS issues, sex drive, low sex drive issues, irregular or no cycles, or irregular or not regularly ovulating, weight gain, bloating, fatigue, headaches, migraines, cravings, hot flashes, and even wrinkly skin. So just a quick introduction about who I am and how I'm able to help so many people all over the country. I'm Dr. Josh Hansen. My training is as an acupuncturist and in Chinese medicine. So I have this background in this beautiful Eastern medicine, which is really a holistic medicine. We look at the body as a complex series of systems that are either functioning or not functioning well. And that was really the father of this is like the grand idea behind functional medicine. So we're taking this old ancient Eastern medicine and all of the beauty and amazing diagnostic skills that come along with that, but really combine it with modern functional medicine where we use complex labs to really analyze how various systems in your body are working or not working well. And I really just specialize in helping to solve complex problems and connecting the dots so that we can really come up with an action plan to get you feeling better. So I got this cool combination of Eastern medicine and modern functional medicine, and I can work with people all over the country. We can ship the lab tests, the kits right out to your house. You do them in your own house, and you ship them back to the lab, and then we meet through video, and we come up with a really cool plan to get you feeling good. So I like to take a different approach than your regular doctor. So a regular doctor, their real job and what they really do is you come in with some symptoms, they match your symptom up to some type of medication, and you're on your way. You know, you spend 5 to 7 minutes, if you're lucky, maybe 15 minutes in a doctor's visit. You get some type of prescription, and you're kind of on your way, you know. And that's great for some problems, but for about 80% of the chronic issues that Americans are dealing with, in hormone imbalances especially, it's a bad approach. It doesn't work well because you don't address the actual problem that's contributing and causing those hormone imbalances. So I like to take a step back and I like to reverse engineer problems. I like to start at what's the actual root cause problem? Let's fix that so that the symptoms go away. So I asked a couple different questions than your normal doctor might ask. I ask, look, there's a ton of people out there that don't necessarily have hormone imbalances. You know, why do some people have this problem? Why do some people not have this problem? And so to kind of further expand on that, I asked, what are the common factors or conditions in those that do have these specific problems, these specific hormone imbalances? And from there, we can start to tweak things, we can test things, and we can come up with plans to help your body function as best as it possibly can. So here's just a quick snapshot at our treatment model that I use with patients, right? So you come with symptoms, common symptoms of hormone imbalance or weight gain, fatigue, depression, anxiety, even GI problems, and obviously imbalances in your estrogen and progesterone, your sex hormones, so PCOS and stuff like that. So you come in with these symptoms, but here's the deal, right? Those symptoms happen because there's a breakdown in the various body systems. And the main 3 body systems are our hormone systems, our gut, our GI systems, and our liver, our detox systems, right? And these systems break down because there's some type of underlying physiological cause, right? It could be a lot of stress due to emotional stress, trauma, physical stress coming from poor diet, imbalances in blood sugar, nutrient deficiencies, stress and inflammation that could cause breakdowns in these body systems could come from things like GI infections. So it's funny, we often find an underlying and kind of stealth or unknown GI infection in women that are dealing with hormone problems. So we usually like to test both your hormone systems, but also your gut, your GI system, to see if there's something that's just kind of sneaking around that's causing all your problems. And if there is, then we can go in and fix it with some really awesome natural supplements. And so there's always going to be an underlying cause that's causing your symptoms. So my treatment approach is to go in and, one, we want to make sure that we're addressing your symptoms and helping you feel better in the short term so that you're able to go in and do the work required to address the underlying cause, because we're going to test and treat these problems, but there's also a component that you're in control of, and that's your nutrition, and that's your lifestyle, and how you manage your stress and how you sleep. So there's some components that you do have control of, and we help you understand what those components are and take control of them. And then we also address the underlying cause with lab-based supplement programs. So our treatment model, it's just way different than just prescribing a medication for your symptom. It's much more in-depth, and it requires kind of some deep investigation and problem solving, and that's what I do all day with patients. I'm drinking my green tea. This is actually so green tea is really beneficial for detox pathways, actually. And so sometimes in women dealing with hormone imbalances, we'll actually prescribe a green tea, like drinking green tea. Sometimes we'll use a supplement that's an extract of green tea as a part of the treatment approach. It's really beneficial in upregulating or making your detox pathways work better. So let's kind of just begin things with a brief overview of your menstrual cycle. So it's funny, I'll have meetings with patients who I just never really had an understanding about their monthly menstrual cycle, and it's really kind of important to understand this, because it helps you understand why we want to test the things that we want to test, and why we use some of the protocols to correct these underlying imbalances that we use. So there's really 4 hormones that kind of control your monthly menstrual cycle and ovulation and things like that. But we really just let's simplify this, and we're just going to focus on the 2 main hormones, which are estrogen and progesterone. So if you look over here on the left-hand side, this would be day 1 of your menstrual cycle. That's the day that you start bleeding, right? And we have this rise of estrogen in the first half of your cycle, a rise of estrogen. And estrogen helps grow things, right? So along with that rise of estrogen, we have growth of your uterine lining. And that's so you can support implantation in a healthy pregnancy. So estrogen is essential. It's got to rise. It helps things grow. It helps that uterine lining grow. And then it also is important for ovulation. And so around day 14, middle of your cycle, we want you to ovulate. And then we have a gradual rise in progesterone. We want a nice gradual rise of progesterone. And progesterone is your the other important hormone. And if we break that word progesterone down, we get progestation, meaning it helps you sustain a healthy pregnancy. So these 2 hormones and the kind of the careful dance they do at different times throughout the month is essentially what makes your body function well. And if there's changes in these hormone levels, then you're going to feel it. You can have anxiety, you can have night sweats, hot flashes, you can have cravings, headaches, migraines, low sex drive, basically all the problems of hormone imbalance. And if they don't happen at the right time, then you're not going to ovulate, you're not going to build a healthy uterine lining, and it makes it basically impossible to get pregnant. So we want these hormones in balance, and we can measure and test this at different times throughout the month and really target it. So when we take kind of a 10,000 step view and look at all of the various body systems, we can get an idea of the 3 main causes of hormone imbalance. And those are going to be emotional and dietary and mental stressors. So some type of like stress can affect the production of one of our stress hormones called cortisol, and in turn that can affect our sex hormones. And because like 50% of your hormones are made from your adrenal glands. So if there's a lot of stress, then basically production of sex hormones gets just kind of zonked, right? So some type of stressor. It's a large cause of hormone imbalances, and another big cause is pain. Right? So that can be, from surgery or from some type of trauma or some type of hidden inflammation, and we'll often see that inflammation occurring in the GI tract. So that's another area that causes hormone imbalances, is GI tract inflammation or bad bugs that shouldn't be there, that are causing a lot of inflammation and leaky gut and things like that can really just contribute to your GI tract becoming inflamed and not functioning well. That can really zonk your hormones. And then the last area we see hormone issues is going to be with detox problems. So if your detox pathways are kind of backed up, then you can have a buildup of estrogen in your bloodstream, and it can really wreak havoc and make you not feel like yourself. So those are the three main body systems that we like to look at when it comes to the main causes of hormone imbalance. And so this is just kind of a brief overview of how your adrenal glands and your hormones are directly connected. Like I said, about 50% of your sex hormones are made from your adrenal glands, which are these little walnuts that sit on top of your kidneys. And so what happens is there's a couple of areas in our brain, and they literally kind of talk to our adrenal glands and have them spit out stress hormones and then also estrogen and progesterone. So it's important to understand that this communication pathway between our brain and our adrenal glands is really important. We can measure this directly by measuring cortisol levels throughout the day, and we can measure what we call your circadian rhythm, and that lets us understand how well your hormone system is functioning. There's also a communication pathway from your brain to your thyroid and your brain to your ovaries. So your adrenals are a great proxy for all that. Lets us kind of measure things and understand what's working and what's not working well. So every day, throughout the day, you're right, like we talked about, there's just natural rhythm to your hormones throughout the month, but there's also a natural rhythm every single day. It's called your circadian rhythm, and it's based on light and dark cycles, so being awake and being asleep. And throughout the day, different hormones should be secreted at different levels and at different times. And so this is one of the things that we measure is the release of cortisol throughout the day. And we want a nice good spike in the day and a nice gentle taper off down throughout the day. And it's important that these levels are occurring at the right times, because if they're out of sync, then you get problems, and it can lead to more problems later on down the line with both hormone production, but also just how you feel in your energy levels. So like we talked about, the two main hormones that really are the key sex hormones are your estrogen and your progesterone. Estrogen, it helps stuff grow, like your uterine lining, and it's necessary for ovulation. And progesterone is necessary for the survival of an embryo, right? Progestation, and it can also restore your sex drive. So a common problem we see in women, especially when they're dealing with hormone imbalances, very common in things like PCOS, is going to be estrogen dominance. That's where, relative to progesterone, there's too much estrogen. So it can be caused from not enough progesterone, right? So it looks relatively like you have more estrogen than you do, or it can become estrogen dominance can occur when there's detox issues and you get a buildup and a backup of estrogen in your bloodstream. This can lead to things like headaches and depression, anxiety, and an increase in body fat. It can mess with your thyroid hormone. It can mess with your blood sugar control, and can also put you at an increased risk of autoimmune conditions. So that's a really common problem we see. And by addressing detox pathways and addressing progesterone in your adrenal glands, then we can really make a huge difference for estrogen dominance. And there's some positive effects when we improve your progesterone levels. It's a natural antidepressant, so you just start feeling better. The anxiety starts going away. The depression goes away. You get more energy. You start burning fat for energy, so you lose some weight. It helps your thyroid to function properly. It normalizes your blood sugar levels, and it's a precursor to all your stress hormones, to cortisol. So it's important that there's a perfect balance of progesterone and estrogen. Now, a problem that I see, and I see this literally every time I have a conversation with someone, and it's really common when someone is dealing with hormone imbalances and issues, they go to their regular doctor and they prescribe them birth control. Well, look, that is not a good solution to hormone imbalances. It doesn't fix any problem. It's literally just a Band-Aid. And the second you stop taking that birth control, well, what do you know? problems are back, right? And oftentimes they'll be worse than they were when you started years before on the birth control. So birth control is not a solution to hormone imbalance. It's barely even a band-aid. It's not a good idea long term. There's much better ways to both test and address hormone imbalances. So we're going to talk about some of the common stressors and common causes of hormone imbalance here, kind of dive a little more deeply into every little body system here so you get a better understanding, because we just covered your normal monthly cycle and how that really affects everything. So let's talk about what can cause these hormone imbalances. So like we mentioned earlier, emotional stress, dietary stress, and pain and hidden inflammation are going to be main contributors to hormone imbalance. Now the big cause is going to be xenoestrogens, and these get built up in your body when your detox systems aren't working well. And what they are is they mimic estrogen. So they're hormone mimickers, and they bind to your hormone receptors, and they can make your body think you have more estrogen than you have. And so if your detox systems aren't working well, you get a buildup of this stuff, and you'll feel terrible. So they come from things like cosmetics, plastics, pesticides, and herbicides, and they can really just mess with how you feel. So we got to get your detox systems working well and remove some of these problems if this is a potential cause of your hormone imbalance. And again, we kind of talked about this, but some common manifestations are going to be PCOS, infertility, PMS, and even premenstrual migraines. And so it's really common. Just having some more of my green tea. It's really common to have PMS. About 75% of women have PMS. It's usually caused by low progesterone levels or estrogen dominance issues in the luteal phase. So that's the second half of your cycle. All right, the first half of your cycle is called the follicular phase. It's where you're building an egg, and the second half is when you're trying to support a healthy implantation. And so about 75% of women have PMS, and in about 15% of women it's really severe. And we find one of the common factors that cause all of these severe problems is going to be lifestyle stressors. So that can be work stress, financial stress, some type of illness, death of a loved one, some type of breakup or divorce, or just stress because you have a bunch of kids and they're just zonking you out, right? When there's a lot of stress, cortisol levels rise. It causes eventual drop in cortisol levels, and it causes your sex hormones, your progesterone mainly, to become lower than they should be, and it can lead to a ton of problems. And this is kind of the pathway that we find is occurs when infertility is a problem. And so we're going to go over a case study in a second here. It's kind of nice to understand how things break down, especially when it comes to our hormones, and when it comes to especially like infertility. So when it comes to infertility, what happens is our stress hormones get elevated, again, from overwork or taking birth control for long periods of time, or work stress or divorce. Some type of big stressor, really, it taxes our body's ability to respond to that stress. And eventually that causes hormone imbalances. It causes our immune system to become weakened, and we end up usually acquiring some type of gut infection. This can come from the foods we eat. It can come from a number of different areas, and we will develop some food intolerances, and our gut will get all inflamed. And eventually this will kind of back up our detox systems, and they'll become overwhelmed, and we'll get this buildup of estrogen, we'll get this drop in progesterone, and we just get a bunch of problems, and it can cause infertility. And this is really common in women that are experiencing PCOS, right? We get this just kind of clear and common breakdown. So they'll deal with blood sugar control issues, they'll deal with IBS or diarrhea or constipation, and then the detox systems just get completely overwhelmed, and they just got this buildup of estrogen and testosterone and insulin, and they just don't do well, and they deal with the fertility issues, and that's kind of the process that happens there. So let's talk about Nicole. She was a patient that came to see me a couple years ago. At the time she was 33, and she was a lawyer, and she had fertility issues. So she was having trouble getting pregnant, but she also had a miscarriage, and then she also had some gut issues. She was having some diarrhea and kind of sensitivity to some foods. So we'll break this down into kind of 3 different little sections here. So when we did a really in-depth health history on her, where our first meeting, we're going to spend 60 minutes together understanding what's going on with you. A normal doctor visits like 7 minutes and they interrupt you in 2 seconds. We don't do that at all. So we found out that she had food poisoning when she was in college. So she picked up some kind of bad bug. She was on birth control for 8 years. All right, that'll just zonk your hormones out in and of itself. And then she had a really stressful school career, going to law school, but also a very stressful job. And this caused, obviously, we had a couple of body system issues. So we had a GI infection, so it's some type of infection in her gut or an overgrowth of bad bacteria that she picked up from that food poisoning from eating some type of food that made her super sick for a couple days. And that just kind of lived and grew and manifested and caused all of these gut symptoms that she was dealing with. And then she also had adrenal burnout. So that stress over a long period of time will just tax your body's stress response, and eventually that will tax your stress hormones and really cause them to become kind of wrecked. So she had overgrowth of bad bacteria and a hormone imbalance. In the end, those were the main symptoms she was dealing with that were causing her fertility and her gut issues. So we went in and we did some specific tests. We tested her hormones throughout the month to see their balance throughout the various days in the month. And then we also tested her gut with a comprehensive stool sample to understand if there's inflammation or bad bacteria or overgrowth of bacteria or parasite infection. And it turned out she had an infection in her gut and her hormones were all out of whack. So we cleared up her gut issue, helped heal up the intestinal lining, and then we also addressed her hormones by basically mimicking her body's natural hormone production with an adrenal program. And then we also used a touch of all natural bioidentical progesterone that's plant-based. You put it on your tongue. It's really gentle, and we used that for a few months to get things back in balance. And now she's got 2 kids. Both are healthy. She's doing great. No more tummy issues, no more hormone issues. Back to living life as normal. So that's a cool story. Got a gazillion of these. They're all pretty similar, honestly. We always find some type of hormone imbalance. A lot of times we'll find a gut or detox issue. We just go in and correct those with lab-based programs based on your specific labs, and you feel great. So some common stressors, again, hidden inflammation. We'll usually find some type of like stealth infection in the gut. Right? We can only do that if we test for it. If we don't do the right test, right, the stool samples that a doctor might order, like your regular GI doctor, honestly, they're just not that comprehensive. They're pretty old school. So we do a really comprehensive testing when it comes to stool sampling into hormones, into your detox systems. And some other issues are food reactions, injuries, surgeries, and even parasites. So here's the deal. What you think and how you perceive the world will literally change how your body responds to anything, right? So what you think and how you perceive and view the world will change mental and emotional responses, which eventually turn into these electrical changes in our nervous system and in our heart. And that can cause changes and affect both our immune system and our hormonal response. So what we think and how we perceive the world can literally turn into a physiological effect and affect your hormones and even your immune system. So it's important to understand that the way that you view the world is important. How you manage your stress is super important. And that's why we always talk about lifestyle and nutritional strategies when we're working on something, because that's a huge component. It can really make or break your healing process. Some common dietary stressors are eating too much, right? Not moving enough, eating too much sugar or grains or refined food, eating food that's not nutrient dense, and then also food sensitivity. So we often find that people are sensitive to gluten, soy, and dairy. So we usually pull those out in our healing diet, and we focus on eating good whole foods, focus on eating foods that are not like refined, processed carbohydrates, so it's basically stuff in bags, and not eating too much. So sometimes we even recommend fasting when we're dealing with some of these hormone issues. It can actually be really beneficial for some women in some conditions. Another stressor is those intestinal pathogens. So I kind of talked about it a few times here. Common ones we see are H. pylori, Blastocystis hominis, Cryptosporidium. These are things that you can pick up and they can cause food poisoning, and then that food poisoning can go on and turn and cause an overgrowth of these bad bugs. But sometimes we'll get people that don't have any GI symptoms, no tummy issues at all, but they still have these hidden bacteria, these hidden pathogens that are contributing to their hormone issues. So that's why we often recommend a gut test to see what's going on, because it can be a big cause of your problems. So it's kind of a logical approach that we take, right? We want to address the underlying cause. We don't want to just come in with a symptom and give you a medication or a supplement just for that symptom. We want to address what's actually causing your problem. We want to get your stress response under control, because as you've seen, that can really affect your hormone problems. Like 50% of the success we see comes from managing the stress response and addressing your adrenal glands. Then we want to identify and address your female hormones and mimic their natural rhythm with some all-natural supplements and all-natural bioidentical hormones that literally just go under your tongue, super easy. We like to individualize these plans based on your lab tests and your personal profile. So we're going to spend enough time with you so we can really do that, right? That comes from time, that comes from understanding your specific health conditions, and really doing an in-depth lab analysis. So we use labs that your normal doctor just doesn't use. We like to test your adrenals and your hormones, your gut, and your detox systems. And these are just labs that your normal doctor doesn't use. They don't really run them commonly because they just don't have the lifestyle and nutritional understanding of how to actually help you. And so we run some cool tests that most docs don't normally run. And the beauty of them is we work with people all over the country, and we can literally just ship these lab kits straight to your house. So it's pretty cool. We collect a urine sample. It's really easy. You collect it and you ship it right to the lab, and we can measure your adrenal hormones, we can measure your stress hormones, we can measure your female hormones, we can check your detox systems, your nutrient status, and even your metabolism. And then when it comes to testing your gut, we do, again, lab kit gets shipped straight to your house, and you can send it right into the lab. And we're checking your digestion, inflammation, to see if you have any infections or those bad bugs, the balance of your microbes, and even the metabolism of nutrients. So these tests are really cool. They're really innovative. They're really advanced lab tests that most doctors just don't run. And so the way that we work with patients, there's a couple different ways. The first way is our Essentials program, and that's for people that kind of need more ongoing support over a longer period of time. So this includes, our Essentials program includes all three of the main lab tests that we recommend. That's your adrenals and hormones, your gut, and your detox systems. But then you get a lot of ongoing support. And so this is a program where we meet 8 times over a period of 6 to 12 months, and we can really work in depth on both, so you understand your lab results, what's going on inside of you. We build a custom supplement protocol and program, and we modify that throughout the 6 to 12 months we're working together. But then we meet a bunch to work on your lifestyle and nutrition, because again, that's a big contributing factor. So this is for people that need a little bit more of help and guidance. But we also do a lot of just one-on-one video visits where we'll meet for 60 minutes. We'll run whatever labs might be necessary for you or that you're interested in running. We'll do a video, we'll record those videos, those labs with a video, and send it to you so you can kind of really understand what's going on with you. We'll build a lab-based supplement program, and then we meet as needed. So there's a couple different options based on what you want and what you need and what makes the most sense for you. So here's a cool example of one of the tests we run. This tests your adrenal hormones, right? And we want to, so we're measuring cortisol at different times throughout the day. So we get to literally map out your circadian rhythm. And so this patient had, they just weren't making that much cortisol as a whole. Their cortisol levels were low. That lets us know that their progesterone levels were going to be super low. Their DHE levels, which is just another hormone, it's like a precursor to estrogen, and their levels were really low, so they had low estrogen also. And they were just kind of tanked and feeling really tired and fatigued. And so we went in and we corrected all this, and it really makes a huge difference. But you can't do that unless you do the right testing so you can understand what the labs actually look like. So that's a cool lab test. And like I mentioned, right, 50% of improvement in hormones come from testing your adrenal glands, from this test here. Right? We can fix problems like PMS, depression, and insomnia, and low libido, and headaches, and hot flashes of night. So it's all from this simple test here. So it's a really good start and gives us a really good idea of what's going on. Now, in some people, we need to map their hormones out through the entire month. So basically, it's just an expanded test that it's expanding like a test kind of like this, but we're getting a really good snapshot of your estrogen and progesterone levels at different times throughout the month. And so we can see, like in this patient, their estrogen levels were a little low as a whole, so they weren't making a good uterine lining. It would be really difficult to get pregnant because of that. But also it would be difficult to get pregnant, and they were probably dealing with some anxiety or some type of headaches or migraines here in the second half of their cycle around day 19, because there was this big drop in progesterone. So we want those levels to climb up nice and high, but there's a nice drop here, and so they were definitely going to be dealing with some symptoms there. So we can go in and we can correct all that, but we're getting measurements through multiple days throughout your cycle, and it really gives us a good idea of what's going on. So this is a cool test to use in people that are dealing with PCOS or cycle issues where their hormones are just all over the place, or women that are trying to get pregnant. It gives us a good snapshot. So we break things down into 3 stages when it comes to hormone imbalances. Stage 1 is a distribution problem. Stage 2 is a low production problem. And stage 3 is a mid-cycle problem. So when there's poor distribution, that means that your hormone production is out of sync with your natural cycle. So you're making enough of the estrogen and progesterone you need to function and feel good, but they're just out of sync with your natural cycle. So you're making enough, but they're not happening at the right time. It's kind of like an early stage issue. It's not going to mess with your ovulation. You're just not going to have those hormones at the exact right time that you need them to really function well. But as things start to progress, you start making not enough of those hormones, and this can be a real problem. It does require a little bit longer to treat this, and usually we'll use a little bit of bioidentical progesterone to really balance things out, and that's like a 6 to 12 month program for something like this to get things functioning well. Stage 3 is when there's timing issues. This is really common in for women that don't ovulate or ovulate at odd times or out of sync with their natural cycle. And their whole cycle could be out of sync too. So this could be if you have a really irregular cycle or no cycle at all. So oftentimes this is like what progresses when someone has PCOS. And so you can have short cycles or long cycles. Basically everything's out of whack. And so when there's timing problems, stage 3, it's really difficult to get pregnant, and can also lead to excessive bleeding. Stage 2, it's going to have potential cycle-long problems like low libido, poor memory, things like that. And if there's stage 1 distribution problems, PMS symptoms, also you can deal with migraines at the beginning of the month. So it just really depends on where you're at. Again, we don't know unless we do some specific lab testing. So here's another cool case study. This is Christy. She was a patient that came to me. She was 34 years old. She was a manager. She was trying to get pregnant. She had irregular bleeding and an irregular cycle. And she was dealing with palpitations and anxiety through her entire cycle. And then she would get cramps and diarrhea before she started her period. And so she had a stage 2 problem, right? She wasn't making enough hormones, and she also had a gut microbe problem. So we found that she just, all of her hormones were way low. So we had to go in there with an adrenal protocol and help to correct that. And we also used a little bit of bioidentical progesterone to really bump things up into what we call the physiological range. So she felt good. And a few months in, she was amazing, felt great. And she actually has a little baby girl now. So pretty cool. Again, we wouldn't have been able to do any of this without the right testing. So our clinical model, again, it's a little different than your normal doctor because we're focusing on all this lifestyle and nutrition stuff, like how you eat, move, sleep, and manage stress. It's all a big contributing factor to how you feel. But then we do this cool advanced lab testing, and we test, your adrenals and your hormones and your GI system and your detox systems, and we can really make a huge difference because we do these advanced lab tests, but we also combine them with diet and lifestyle and nutrition, and the combination of the two is really where the magic happens. So my approach, again, it's pretty logical, right? We do some specific lab testing. We use some natural supplements based on those lab tests, and then we work on diet and lifestyle changes, and when we combine all that, you get health. So usually we'll start with an adrenal program, and we'll mimic the natural production of your hormones with all natural hormones. And these aren't something that you would be on for the rest of your life. They're short term, 6 to 12 months to get your body to do what it's supposed to do and function well. Then we can get off of those and you feel great and things are back to normal. We also want to make sure that we test for any GI or detox issues. If that's necessary, most of the time it is. We find that there's some type of hidden underlying cause. And then based on all those lab tests, we use the most effective, best absorbed supplements where indicated. So that's our approach. Pretty cool. way different than what your normal doctor does. Here's another cool case study. This is Leslie. She was 39 when she came to me. She had depression, fatigue, night sweats, and she had an upset stomach. So we ran a month-long cycle map on her, and then we also ran a gut test. We saw she had an H. pylori infection, so that was causing that upset tummy and a lot of inflammation in her stomach. And we also saw that she had some big issues with her progesterone. She had this interesting drop here around like day 17 of her cycle, or we want a nice bell curve here, right? And she just had this big drop and then boom, off. So we want that to taper off a little more slowly too. So this will cause night sweats and fatigue when you're getting these fluctuations of hormones. And again, we went and corrected her gut, and we went and corrected her adrenal glands, and everything felt great, and she did much better and got things under control. So let's talk about some actionable stuff that you can do right now to start feeling better. First place to start is to remove things like gluten, dairy, and soy. All right, that can eliminate a lot of problems in of itself, because those are foods that can really inflame your gut. We want to focus on eating some good high-quality proteins, non-starchy veggies, and healthy fats to control your blood sugar levels. That can again help to control your hormones. So this is a big thing that we focus on with women with like PCOS. We want to focus on our healing gut, on our healing diet guidelines here. So get rid of the processed foods, eliminate soda and sugary drinks, get rid of the additives and the leaves. They're terrible for you. And then we just want to focus on eating meat and vegetables, nuts and seeds, a little bit of fruit, a little bit of starch, and no sugar. And we want to make sure we don't eat too much food, because we don't want to add excess body fat. So it's kind of just a breakdown of our healing diet. It's important to remove gluten and dairy at first, because again, they can be inflammatory stressors to your body and really mess with your hormones. And then there's some simple lifestyle changes that we always recommend. Got to do some type of exercise. I like walking and yoga, and even weightlifting is really beneficial. All right, we got to do some type of stress relief, meditation. I like Headspace. It's a free app you can get on your phone. Do 10 minutes a day, no excuse. Just do it. It's great. Got to get 8 hours of sleep. Super essential for healing and recovery. And then again, remember how we think, right? Our mindset and the relationships we have can create physiological changes in our body. So we got to have healthy relationships and a good mindset. So let's just kind of summarize everything here. So you've learned a lot, right? You probably know more about hormones now than you've ever known. You know more about your monthly cycle and the different rhythms of your circadian rhythm now, right? And hormone imbalances can cause a lot of problems, from PMS and hot flashes to anxiety, depression, and infertility. So it's important to understand that, and to know that you really are feeling these problems, right? They're real. They're because your hormones are out of whack. And birth control, it's not a solution, right? So now you understand the cycle and why it's important. You understand why imbalances occur and what you can do about them. And then we went over the 3 stages of hormone imbalances. That's poor distribution. That's where you're making enough, but it's just not necessarily at the right time. Stage 2 is low production, where you're just not making enough of estrogen or progesterone. And stage 3 is where there's timing issues, like your cycle's all messed up, you're not ovulating at the right time. That's kind of the more advanced stage. And so you got a really good understanding of all that and how we go in and test and address those problems. So if this makes sense to you and you want to have a talk with me, then you can go to drhansen.com/apply. And you can schedule a free 15-minute consultation where we'll go over what's working for you, what's not working for you, and can let you know what makes the most sense if you want to get moving forward and get your hormones under control. So go to drhansen.com/apply if you're interested in learning a little bit more about how it can help you and what it looks like to move forward in doing that. So I look forward to speaking with you. I hope you learned a ton here, and I'll come at you with some more great information here soon. Have a good day.